time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, when I get in my crew, boy, you can't get in my crew. Me, XL, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Good evening, good morning, and good afternoon. Welcome to another episode of Kidney Hub East Africa. I am half your host, Steve, the kidney nurse. I'm not sure what happened to Brother Moses. Please keep him in your prayers, your thoughts and prayers, because I texted him this morning, sent him the information, and I heard no response. And so that could be a good thing or that could be a bad thing. See, I don't know because he's all the way in Kenya. But today, we had a topic that we really wanted to discuss. And we know this topic impacts many kidney warriors in East Africa. In fact, it affects so many, some of them can't even get the operation they may need to have a favorable outcome. Let me give you some startling statistics on heart disease. Did you know that heart disease is the #1 cause of death in persons with chronic kidney failure? Now, according to KDOQI, and this is KDOQI established by the Kidney Foundation, and a look at indicators and factors and use evidence-based information pretty much to have overall healthy outcomes in patients that's going through dialysis. They say that 47% of dialysis patients' deaths are due to cardiovascular issues. That's why many patients on dialysis have a cardiologist. Now, this show is about congestive heart failure. But heart disease can lead to that, or vice versa. Now, let's look at many of the problems that's commonly associated with kidney failure and how it can affect the heart. Then we're going to go into what is CHF, or congestive heart failure. Number one, anemia. The vast majority of persons with chronic kidney failure suffer from low red blood cell count. That's why you have many warriors, when they start dialysis, they may be fatigued, maybe short of breath, and they know they ain't got fluid on them. Tired. All that are symptoms of anemia. Now, as the amount of hemoglobin in your blood decreases, the ability, of the blood to carry sufficient oxygen throughout the body also decreases. So when your blood count decreases, that oxygen needed throughout the body is going to decrease. Now, in an attempt to compensate for this, the heart is going to beat faster. Over time. That's why when you at dialysis, right, and you may got a low hemoglobin around 9, 10, and you got a high pulse rate, 120, 130, it's always high. Over the long term, they said over time, this can cause the heart muscle to thicken and enlarge, also known as left ventricular hypertrophy, or LVH, which may lead to heart failure. Then you got high blood pressure, another culprit, or hypertension. And dialysis patients retain fluid. Okay? That's why we talk about in between treatments, limit that fluid between 1 to 3 liters, 32 ounces per day. If you urinate, they may push it up to 48. As fluid weight increases between dialysis treatment, especially tomorrow, you ask the kidney warriors that go to dialysis Monday, Wednesday, Friday, and they tell you Mondays, a lot of them would tell you Mondays are the hardest days because it's 3 days in between treatment. You got Friday, Saturday, Sunday, and you go to treatment on Monday. And the same way if you go to dialysis on Tuesday and Thursday, Saturday. You got Saturday, Sunday, Monday, Tuesday. Now, the pressure inside blood vessels increases with the fluid. Now, pumping against this higher pressure increases the workload of the heart. Similar to anemia, left ventricle hypertrophy and heart failure can develop. You got high blood pressure. You're gaining fluid. Let's talk about the number one cause of kidney failure, kidney disease. Diabetes. If you got that, now there's a direct link between diabetes and heart disease. There's a direct link. That same fat, that visceral fat, or that unsaturated fat, the saturated fat, not unsaturated, but the saturated. And triglycerides and cholesterol. When it starts coating the cells, that same fat is the same that coats or thickens or blocks, however you want to call it, the arteries to prevent oxygen and blood to go into the heart. About half of our dialysis patients have diabetes. Again, diabetes is the leading cause of kidney failure, kidney disease. And persons with high blood sugar levels are more likely to have low HDL and high triglycerides. Both of these levels lead to arteriosclerosis and coronary artery disease, including a narrowing of the vessels that supply the heart with blood. It supplies the heart muscles with blood. Last night, I talked about this and even showed a picture of the narrowing. You had the healthy artery, then you had the buildup, and then you had the blockage, and it showed the narrowing. Now, what can happen from this? Angina or chest pain and myocardial infarction, a heart attack, can follow. Let's talk about abnormal cholesterol. This is all real. It's not Memorex. Abnormal triglycerides and cholesterol levels, which also lead to arteriosclerosis and heart disease, are seen in many persons with chronic renal failure, even in young adults and pediatric patients. So if you're on here watching, you're like, I'm 25, I'm 30. It can happen to you too. And in fact, go check out the young lady, Snap Back to Life. Young lady, 27 years old, advocates kidney disease to her population. Why would she do that if it wasn't a need? Yeah, if you in your 20s, the 30s, 40s, the 50s, anyone pretty much is a fair game right now. And it don't have to be diabetes and hypertension. That's what I just happen to advocate for. But you got other things that center around that leads to kidney failure. Lupus, sickle cell, medication issues, or medication toxicity. What else? Trauma. You could be in an accident. Your kidneys could shut down. Let's talk about chronic inflammation. The American Heart Association, AHA, believes inflammation also plays a role in both the initiation and the progression of arteriosclerosis disease. Factors commonly seen in dialysis patients, such as clotted access grafts, failed kidney transplant, arteriosclerosis, also known as hardening of the arteries, uremia, urea in the blood, and persistent infections cause inflammation. And how many patients you know or watching this had to go get a declot? How many had a failed kidney transplant? You on your second or third transplant. Uremia buildup, the toxins in the poison. All that can cause inflammation. Also, metabolic acidosis. The acidity from kidney disease inside your body. Some people, the kidney doctor probably tell you, hey, why don't you take some baking soda? Try to reduce the acidity level. Or sodium bicarbonate tablets. And that's why we had the bicarbonate with dialysis. It just used to be acetate bath. A lot of people got sick off of that. Now you got the bicarbonate, which is a buffer. Let's talk about bone and mineral disease. And then we're going to go right into CHF. Kidney failure leads to abnormal calcium, phosphorus, and parathyroid hormone levels. How many of you are dealing with that issue right now? Your parents, your loved one, or even yourself. If you watch it from TikTok, everything I say on this broadcast applies to TikTok as well. So I have my stream going. You never know who may need to hear this information. So you won't see me, I'm going to cut off TikTok and just cut it on here. That wouldn't be fair, especially when it comes to life-saving information. Now, let me repeat. Kidney failure leads to abnormal calcium, phosphorus, and parathyroid hormone, also known PTH levels. These then cause blood vessels. Let me repeat that. When those levels are high, abnormal calcium, phosphorus, and PTH, these then cause blood vessels, including those within the heart, to calcify. And if that happens, and you want to get on the list for transplant, and you go do your pre-evaluation workup, and they see that you have some calcification on your heart, guess what? Or on the vessels leading to that transplant is a no-go. And there's no, when the calcium go away or they go away, that's an automatic disqualification. That's why going to treatment, taking the phosphorus binders, and the if you want Sensipar for your PTH, or the Sincalcicet, the green pills they give you in the clinic. Those are important. Don't just put them to the wayside and be like, they hurt my stomach. Let somebody know, but that right there could be the difference of you taking them and keeping these numbers, these levels down. And if you decide to get a transplant and you getting a transplant, I've seen people get turned away after years, and they trying, doing the right thing now because they want to get a transplant, and they go and they say, they can't get it because they have some calcification going on. I got a lot of comments that I'm going to read, but let's talk about congestive heart failure. What does the term mean to you? Now, I'm going to go on one information, then I'm going to go on some other information. Okay. Now, congestive heart failure, or CHF, can be a common diagnosis. Let me tell you, let me repeat that. Congestive heart failure, or CHF, can be a common, diagnosis, especially in older dialysis patients. As its name implies, both heart failure and congestion of fluid are present. So when you have a failing heart, then you're going to have congestion, then you're going to have the diagnosis of CHF. Now, with congestive heart failure, the ability of the heart to effectively pump blood throughout the body is decreased. As the heart muscle weakens, blood slows and congestion occurs. And let me look at the comments. I thank you. And let me put a picture up too, right quick. Hold up. Oh, okay. Okay, hold on. Let me put this up. So if you can't see this picture if you're watching TikTok. I have a picture up on the screen. All right, let me look at this. Hey, Urban Legend. Hey, Latasha. I just learned about the functions of the spleen. Thanks, Steve, for the invite. Nikki. Hey, Nikki, 4010, hello. Yeah, LVH, which leads to heart failure. Wow. Thank you, Nikki. Man, the body is working overtime. Thank you. I have a different question about cardiovascular disease. Yeah, inbox me, Nikki. Snap back to life. Check out her page. Nikki, why does my kidney doctor say I have cardiovascular disease, but my cardiologist says I don't? All right, let me answer that. You got two different opinions. Hey, Cherry, thank you for joining. You remember when I said the art of medicine is not an exact science? So we had a question by Nikki 4010 chat on TikTok. She asked, why does my kidney doctor say I have cardiovascular disease, but my cardiologist says I don't? Are they different? You got two different doctors. You got a specialist, a cardiologist say she doesn't have it. And then you got kidney doctor, nephrologist says she does. And that could probably be based on if she's having CHF. Again, heart disease is the number one. And then, so if you go down of those anemia, high blood pressure, diabetes, abnormal cholesterol, chronic inflammation, bone and mineral disease, these all can affect the heart. And I would suggest, I can't speak for the kidney doctor or the cardiologist and why both of them have two differences of opinion, but I would go with the cardiologist because he specialized in the heart. But if you're a kidney doctor and you seeing a patient and you looking and you seeing maybe the cholesterol is high, they're dealing with some anemia, they may have elevated pulse rates, high blood pressure, and if it's some diabetes in that. Now I'm not sure if this is the case with Nikki 4010, or she has some abnormal cholesterol levels. He can maybe, what's the word I want to say? Speculate that he may speculate heart disease or cardiovascular, which is a cardiovascular disease. Again, it's a matter of opinion, and I don't see her medical records. So the doctor, the nephrologist will be looking at the records and getting one point of view, and the cardiologist, he's the heart doctor, so he should know. So again, that was a good question. And yeah, she don't have congestive heart failure. So I would go with whatever your cardiologist says, Nikki 4010, because he's the heart specialist. But let's look at, and again, that's a good question. Let's look at the picture I have. I got a picture on the screen that I normally show on here. The guy leaning forward. Okay. Hold tight. I got to do this because I want to tell you, my biggest support comes from people on TikTok. They always show up for me. And then I'm starting to get people to show up too on YouTube and Facebook. But you're welcome, Nikki. You're welcome. So right here, again, with congestive heart failure, the ability of the heart to effectively pump blood throughout the body is decreased. Now, if you can see this picture on my screen, right here, you got the normal heart, as you can see, and then you come and it has the enlarged heart, right? And what happens as the heart is working overtime, it weakens and it stretches out. And that while it stretches out, it can't contract and pump the blood like it would if it was, not enlarged. Now, now hear this out. This is important. Where the congestion occurs in the body depends on which side of the heart is affected. Let me repeat that. Where the congestion or the buildup of fluid, where that occurs in the body depends on which side of the heart is infected. Now, if the right side of the heart isn't pumping effectively, congestion occurs before the blood reaches that side of the heart. Now, you're going to see enlarged jugular veins. We all know what a jugular vein is. You're going to have an enlarged liver. And then you're going to have or see, just like in the picture, right? Edema or swelling in the hands and feet. And you can see in this picture the feet. So that's going to be right-sided. Now, When the left side of the heart is affected, congestion builds up in the lungs. If the left side is affected, congestion will build up in the lungs. Blood flows through the lungs immediately before reaching this side of the heart. Now, what you're going to experience? Shortness of breath, especially when lying down. And I always talk about that. Remember, TikTok would tell you and say how many pillows you sleep with. A lot of people sleep with 3-4 pillows. And again, shortness of breath, especially when lying down, is a common symptom. Any condition that affects the strength of the heart muscle can lead to CHF. 2 possible causes are prolonged high blood pressure and myocardial infarction, which is death of some heart muscle. Now, to help decrease risk related to CHF, you're going to have to work with your healthcare team, limiting your fluid intake, staying close to your dry weight, and keeping your blood pressure within the normal range are 2 ways to help keep congestive heart failure at bay. Let me remove this picture. And here's some of the problems that you can experience with heart failure. You got coughing. That's because of the fluid, the congestion, tiredness, shortness of breath, pulmonary edema, meaning fluid in the lungs. Pumping action of the heart grows weaker. Swelling in the ankles and the legs, we talked about that. Swelling can also happen in the abdomen. And then you can have pleural effusion, which is fluid in the lungs. So let me clear that out the way. Let me leave that up there. Now, let's talk about excess fluid. Oh, before I go there, hold on. All right. Again, I pretty much repeat myself, but these are for people who just came in. Say, hey, what's going on? We're talking about congestive heart failure on Kidney Hub East Africa. This information, especially for kidney warriors in East Africa. Do everything you can to minimize your fluid intake. Now, again, congestive heart failure is a condition in which the heart is unable, the heart is unable to pump blood effectively to meet the body's need. Now, this can lead to a buildup of fluid in the lungs and other tissues, causing symptoms such as shortness of breath, fatigue, and swelling in the legs and the abdomen. Now, let's look at the prevalence of congestive heart failure in dialysis patients. And as I mentioned, congestive heart failure is notably common among patients undergoing dialysis. You don't want it, but if it happens to fall on you, know that it's common. Several studies and statistics highlight the prevalence and significance of CHF in this population. Now, as I said, it's a high incidence. Approximately 30 to 50%. 30 to 50% of patients on dialysis have some form of heart failure. The prevalence can vary based on the population studied, the definition of heart failure used, and the presence of other comorbidities. That's why I said to Nikki 4010, the art of medicine, and this is to anyone. You want to know why one doctor says this and the other says that. Because the art of medicine is not an exact science. That's why you got different matters of opinion. One doctor may say one thing and another may say another. And if that's the case, you go on the strength of the specialist. The nephrologist specializes with the kidneys. The heart doctor or the cardiologist specializes in the heart. So if the kidney doctor tells me one thing and the cardiologist tells me another, guess whose side I'm going to favor on? It ain't going to be no damn kidney doctor, because that's not his specialty. His specialty is the kidney. Just like I wouldn't expect the heart doctor, the cardiologist to tell me about nephrology. Number 2, increased risk factors. Patients with chronic kidney disease and those on dialysis often have multiple risk factors for heart failure. Remember, that's what I was saying to Nikki 4010. The kidney doctor may see some shit that say, oh, she has it, but the cardiologist say, nah. Increased risk factors. Again, patients with chronic kidney disease and those on dialysis often have multiple risk factors for heart failure, including hypertension. Didn't I say that? Diabetes and atherosclerosis. These conditions are prevalent in the dialysis population, thus contributing to the high rates of CHF, congestive heart failure. Number 3, cardiovascular disease burden. Cardiovascular disease is the leading cause of morbidity. It's the leading, I said that in the beginning. It's the leading cause of morbidity and mortality in patients with end-stage renal disease, or ESRD. Heart failure is a significant component of this burden, and patients on dialysis are at a higher risk. They're just at a higher risk. That's not going to say you're going to get it, but you're at a higher risk for developing heart failure compared to the general population. That's why I say, if you got kidney disease, kidney failure just came into your life, your mom, your dad. This is an all-out assault in getting the education you need to battle this and stand in front of it. Bare knuckles. Number 4, dialysis modality impact. Dialysis modality impact. Now, what does that mean? Dialysis modality impact. It means the type of dialysis you do is going to have an impact for you getting heart failure. Now listen to this. The type of dialysis, hemodialysis versus peritoneal dialysis. That's when people say, hey, what treatment option should I do? And that's where you sit down and you go through each treatment option and you look at the risk versus reward in your lifestyle. Now, hemodialysis versus peritoneal dialysis, or the type of dialysis, may influence the prevalence of heart failure. How so? Some studies suggest that patients on hemodialysis may have a higher incidence of heart failure compared to those on peritoneal dialysis. Although both groups are at increased risk. Now, I can't tell you what studies. That's where you got to go on your own and look. This is where the research comes in. Now, let me give you some contributing factors, warriors, especially our brothers and sisters in East Africa, if you're watching this, because I know it's almost about 9 o'clock p.m. But let me tell you about the contributing factors to CHF, or congestive heart failure, in patients on dialysis. Now, there's several factors that contribute to the high prevalence of congestive heart failure in dialysis patients. Fluid overload. I said this before. Fluid overload. Patients on dialysis often experience fluid retention, which can increase the workload of the heart and lead to heart failure. Now, I'm going to talk a little about that, and then it's it. Hypertension. Many dialysis patients have poorly controlled high blood pressure, which is a significant risk factor for heart failure. You know, if you're watching this, you know if you got poorly uncontrolled hypertension. I don't know. Only you know. And if you are dealing with that, check out the ticker going across my screen for my book, Conquering the Big Three: A Guide to Diabetes, Hypertension, and Kidney Disease. Don't just sit around and expect this to just magically disappear. Because if that's what you're waiting for, diabetes, hypertension, kidney disease in the stages 1, 2, 3, 4, and 5, but you're not on dialysis, they're not going to disappear. It's going to take work. And this guide is not to replace what you already have in place. It's to be a companion. But if you don't have nothing in place, then you're going to want this to be the book you read, and then you hightail it to your nearest physician, PCP, and see what's going on with you, so you don't become a victim of circumstances. Here's another one, anemia. I talked about it at the beginning. Common in kidney disease, anemia can lead to decreased oxygen delivery to tissues, putting additional strain on the heart. I mentioned uremic toxins. The accumulation of waste products in the blood due to kidney failure can have detrimental effects on cardiovascular health. As they say in Jamaica, come on, man. I'm just trying to get the accent down. Let's talk about the metabolic disturbance. Electrolyte imbalances and changes in calcium and phosphate metabolism can affect heart function. Again, when we talk about calcium and phosphate metabolism, we're talking about calcification that can possibly happen. Now, congestive heart failure is a prevalent and serious condition among patients on dialysis. Significantly, now I say that lightly, impacting their quality of life and overall health outcomes. Seriously. Due to the complex interplay of risk factors. Oh, Brother Moses was traveling. He just hit me on the back end. But due to the complex interplay of risk factors associated with chronic kidney disease and dialysis, it's essential. Seriously, it's essential for healthcare providers to monitor and manage cardiovascular health activity actively in these patients. So what that mean? Regular assessment, lifestyle modifications, and appropriate medical management are crucial to reducing this risk of heart failure and improving your outcomes. Now, let me talk about, I got about 10 minutes. Now, we have a lot of patients that's on dialysis Okay, so just like that, say, which article are you reading from? It will have a link to the studies at the end. It would be more easier for us to look at the studies that way. Well, it's a combination of information. It's not from a direct study paper. But if you would like to go look at a study for heart disease and kidney failure or CHF, you definitely go to the National Kidney, not the National Kidney Foundation. What's that? Hold up. National Institute of Kidney Digestive Diseases. But I use a lot of resources that I have accumulated throughout the years. Nikki says, FYI, it was the surge, and they think it has something that are maybe too thick. Okay. Wow. So let me finish what I was doing. So what I was going to talk about right quick is a lot of patients get valve replacements or may require heart valve replacement for several reasons, primarily related to the effects of chronic kidney failure, or chronic kidney disease, and the associated complications with dialysis. I'm just going to give you some key factors that contribute to the need for heart valve replacement in patients on dialysis. Again, hold up. Cardiovascular disease. And we know patients with chronic kidney disease, especially those on dialysis, are at significantly increased for cardiovascular disease, including heart valve disorders. This increased risk is due to factors such as hypertension, diabetes, and accumulation of uremic toxins can affect the heart. And even, again, when it comes to high cholesterol, triglycerides, then you got calcific aortic stenosis. Now, this is one common heart valve issue in dialysis patients is calcified aortic stenosis, where calcium deposits build up on the aortic valve, leading to narrowing and obstruction of blood flow. Now, again, this can happen in the heart, in the arteries in the heart, calcification. That's why when they go and you get a workup for a transplant, they look at that. When you go to the cardiologist, you get on the treadmill and do that because they want to see how strong your heart is. Can it take that surgery? And if you got blockage or calcification in some of the arteries, it's not going to help perfuse the heart because you're going to have that blockage. Now, this condition can be exacerbated by the metabolic changes associated with kidney disease, again, including disturbances in calcium and phosphorus metabolism. And then you got ineffective endocarditis. Dialysis patients are at higher risk for infections, because of the catheter, which is an infection of the heart valve, endocarditis. This can occur due to the presence of vascular access sites such as the fistula or catheter or the graft, if it get infected. And that's why if you see the picture of the heart that I had with the catheter and where that placement of the end of the catheter is located, that's why they're real particular about cleaning that catheter and being careful not getting that infected, because those germs can travel straight down that catheter. And then again, for the heart valve replacement, you got hypertension. Everything that I said, leads to that. It can lead to the uremic, the buildup of waste. Age play a factor in that. Volume fluid overload. And then let me just say this before I go about excess fluid, how it can impact the heart. Now, this actually information is right here. This is from information, again, that I collected over the years, almost 4 decades of information. And it hasn't changed. Information from the 90s and the 80s, you can still apply it today. Now, here goes some of the signs and symptoms of excess fluid intake. And again, tomorrow, okay, hold tight. Tomorrow is Monday. And a lot of people have a hard time on Monday because of the 3-day weekend, same as Tuesday. But here are some of the signs and symptoms of excess fluid: belly bloating, swollen ankles, trouble breathing and coughing, nausea, enlarged heart leading to heart failure. So the kind of symptoms you could probably expect will probably be shortness of breath, all the symptoms that leads to heart failure, swelling in the feet, enlarged heart, again, trouble breathing, possibly your high pulse rate. But you should also, if you see a cardiologist, you should be going to visit that cardiologist as well. But you'll have some symptoms, could possibly be chest pain, angina. And then it depends on what valve. So I talked about heart failure. Years of high blood pressure and excessive fluid retention may eventually weaken the heart power to pump. And so they have an example of how an enlarged heart looks compared to a stretched, deflated balloon. But I showed you, and you see the pictures. You look at, you see the normal heart on here. When you control fluid gain, the heart can return to its normal size. When you have occasional fluid overload, heart starts to lose elasticity. When you have frequent fluid overload, the heart stays stretched out and becomes weaker. So if you continue to gain 4 or 5 liters, you're doing yourself a disservice because it's stretching the heart out. Now, reasons why too much fluid was gained between treatments: excess sodium and fluid intake, the extra day over the weekend that I mentioned. The extra day over the weekend may result in extra fluid intake. Any missed or shortened treatments. Now, let me say this. Okay, let me finish this first. Reasons why fluid removal was inadequate: complications and or too much food fluid intake during dialysis, inaccurate weights, seasonal clothing differences, contents of pockets. Now consider these actions. Limit sodium intake to 2,000 to 2,500 and fluid to 32 ounces per day. Now I say limit that sodium intake 1,500. 1,500 to 2,000 per day. Attend all treatments as prescribed and reschedule within the same week if missing any treatments. One should consider these actions to try to change their behavior and reduce the excess fluid. Now, what I was going to talk about was the any missed or shortened treatments. If you cramp, say it's you 4 hours, and at the third hour, you in your fourth hour of treatment, you cramp, and you say you got like 50 minutes left. That's not a reason to end your treatment. Now, I know some people are like, hey, man, you're not on that machine. You don't know and that's true. But listen out. If you cramp, there's intervention for us to do. You still got to get your blood clean. Because that dialysis cleans your blood. It cleans the blood and pull off excess fluid. If you cramping, we got to look at your dry weight and we got to give you interventions to correct that. But there's no reason to, hey, give me the AMA, I'm signing off. Because now you're doing yourself a disservice. Because again, we got to clean the blood. And if you have, again, if your blood is not effectively cleaned, you can have some post-dialysis issues. Still feeling tired, fatigued, itching, dry skin, maybe some nauseous. No, I'm saying nauseous. Maybe some having a nauseated feeling, possibly vomiting. The list goes on and on. But the point is, please, if you're on dialysis, your loved one, your partner, your mom, your dad, and you hear the word heart failure from any of the doctors, because that heart failure, if it get worse, it could get to a point where you may need a new heart on top of a kidney. And now you may have to get what's called an LVAD. So if you're on dialysis, your mom, your dad, your loved one, please, again, limit your sodium intake I say, they say 2 to 2,500 per day. I say 15 to 2,000 per day. And limit your fluid to 32 ounces per day. If you still urinate, they give you a little bit more leeway. Attend all your treatments. Don't shorten anything because you're doing yourself a disservice. Remember, healthy kidneys work 24 hours, 7 days a week. And when you go to dialysis, over in Kenya, it's 4 hours twice a week. That's 8 hours a week, 32 hours a month. 32 hours a month, and the kidney, healthy kidneys function 24 hours a day, 7 days a week. So, and if you have to miss any treatment, see if you can reschedule in that same week. Because if you're over in East Africa and you do 2 treatments a week, you miss one, that's only 1 treatment for the whole week. 1 treatment for the whole week. And over here in the United States, they do 3 treatments a week. You see why this information is so vital, important. So, that being said, I had got word that Brother Moses was traveling, and he reached out to me yesterday behind the scene, but I didn't get the message until this morning. So, with that being said, join us next week, right? Join us next week as we would talk about another important topic pertaining to kidney disease, kidney failure. And I hope this topic has helped someone. Okay. Thank you. And please join us again next week, same time, same channel, for another episode of Kidney Hub East Africa. I am half your host, Steve Belcher. Good night. Take care of yourself and each other. Peace.